I'm Roxie Corbett. I have lived in Brookings for 52 years. I grew up in Watertown, South Dakota. I am a glass artist. I contracted influenza A and got very sick, and so my doctor decided I should come to the hospital. They decided I needed to see a pulmonologist, and since there were none here, they transferred me to Avera. I was diagnosed with something called Narcodia infection, something quite rare. For me, it settled in my lungs, and I had bad pneumonia. And it also has, I have 2 abscesses in my brain those are the ones that are having trouble going away. I was in either here or Avera for 3 months, with as long as I was in the hospital to acclimate myself between home and hospital. I thought they were wonderful. They listened to you. I had questions about some of my medications. The doctor sat down with me and explained everything, and it was all good. To be able to function on my own, and I didn't go home right away when I got there. It wasn't until closer to the end. I had to do physical therapy and occupational therapy because after being in a bed all that time, I had trouble walking. So had wonderful people helping me, and eventually I could walk. Oh, they treated us wonderfully. We had great staff. I can't say enough good about them. Keith and I'd get out my walker, and Keith would be beside me, and we would walk around the circle. And there was a nurse sitting at one of the desks there, and she'd say, 1, 2, counting our laps. Yeah, it was fun. Well, I'm not coughing all the time. I do still have, sometimes I have to think to come up with an answer for something because of those abscesses in my brain, but they are shrinking also. So, but it's going to be a long road for me. Lots of antibiotics. And right now I go to the emergency department at the hospital here every 12 hours for a half-hour infusion of antibiotic. Oh gosh, I appreciated everything. The nurses and the caretakers were all wonderful. It's close to home. The staff is wonderful. That's all I can say is wonderful. And like physical therapy, occupational therapy, they were great too. They worked with me as much as they could and got me back to walking and doing things. So yeah, I appreciate being able to come here twice a day and get the care I need. And they're always cheerful and ready for me and cover me with a nice warm blanket. And
Are you one of Brookings Health System's grateful patients who would like to give back to us? Learn more about how you can give back at brookingshealth.org/mythanks.